So why did you choose Australia and take the APC exam? Why Australia?
I studied for 6 months, around 6 months, but I also work full time. So it was kind of like part time studying for 6 months plus working full time.
Can you share some tips on effective study techniques and time management during the prep period?
So I think it was the material that you give and the professors are very good.
Anna, if I just ask you, were there any unexpected questions or tricky questions in the exam? And if they were, how did you handle it? Hello, everybody. Today, we are utterly delighted as the APC Australian Physiotherapy Council results for the March exam 2025 are out and our students have outdone themselves. We have with us today Dr. Anna Nerit-Ducret, a successful student who has cleared the Australian Physiotherapy Council APC exam 2025. Hello, Anna. Thanks for joining us today.
Hi, thank you for inviting me.
So there are a lot of APC aspirants out of there for whom your story will be inspirational. So without wasting any time, let us begin the interview. Please tell a bit about yourself.
I am a physiotherapist. Obviously, I was born in Panama and I moved to Barcelona to study physiotherapy. And I finished around in 2021.
Okay.
And that's around it. I decided to move to Australia around August last year, 2024.
Okay. So why did you choose Australia and take the APC exam? Why Australia?
I think Australia mostly because obviously they have a better quality of life. And as per my understanding, they do have a better appreciation of physiotherapists and the profession there. They're also more advanced in the clinical research and they have a lot more involvement in physiotherapy. So I thought it was a great option.
Okay. And how did you come to know about Academically?
I searched up ways to study for the APC exam, and Academically was probably the first and top option.
Okay. And how much time did it take for you to prepare for this APC exam exactly, Anna?
I studied for 6 months, around 6 months, but I also work full time. So it was kind of like part time studying for 6 months plus working full time.
All right. So you were more inclined towards the recorded lectures, I suppose, rather than the live lectures, correct? Because of your work commitments.
Yes, yes.
Okay. Okay. So was there any difference between the live lectures and the recorded lectures? Did you find any difference?
Well, obviously, the live recordings, you do get to ask questions on site, and with recordings, it was harder to remember the questions and to clear some doubts. I do recommend going through the live sessions more than the recordings because of that. But I think the recordings are a really great option too.
All right, great. So if I would just like to ask you, what according to you was the most difficult time of this APC preparation?
I think it was trying to get to study everything and the time management it took because the APC exam is very challenging and very strict. They require a lot of knowledge that obviously since I left my degree a long time ago, it was 3 to 4 years ago, I forgot some of this stuff specifically because I was very musculoskeletal based now. So yeah, I think it was just the organization trying to study everything on time.
Correct. Can you share some tips on effective study techniques and time management during the prep period?
I definitely use a Pomodoro session. Don't forget to take your breaks because if not, you just have inefficient studying time, which is really not productive. And then I think I had a lot of YouTube videos that helped me through some topics that I wasn't very clear about. And focus on your basics first. Get your basics very, very well understood. And after that, everything else you can clinically reason most of it.
That's true. That's true. So like if I talk about Academically, like when you joined Academically, what part did Academically play in your journey?
I think it was very, very helpful, the fact that you have very good teachers. They explain, especially my cardiorespiratory teacher was fantastic. She explains everything very, very well. And you have a very good basic understanding for you to keep growing on it. So I think it was the material that you give, and the professors are very good.
So, and the assistance from the other teammates, how was that?
Okay, no, yeah, it was good. It was good. Everyone is very on board. Everybody's very attending to you, and they want you to make you feel very comfortable and very supported throughout the whole journey.
Thank you. Thank you so much. Anna, if I just ask you, were there any unexpected questions or tricky questions in the exam? And if they were, how did you handle it?
Yes, I think for me, I remember one of the tricky questions. It was cardio. You always study the arterial blood gas exam and all the questions that we have during our preparation are for the arterial blood gas. And when I went to the exam, they put the venous blood gas and they asked
Yeah,
everything
you
about.
told me that there was a question of like
Yeah,
prepare for arterial blood gas, like ABJ.
yeah.
So,
And yeah, so it was tricky and I was not expecting it. I don't think they are particularly tricky. I think they won't make it easy. Obviously, for pelvic floor, I got a question, but instead of female, it was male, which is a lot more uncommon to see. So again, it's not tricky. It's just not going to be easy.
What advice would you give to someone who is planning to take the Australian Physiotherapy Council written assessment? Like, what should be there in the mind?
Yeah, I think most than anything, just study your basics, learn how to think about your clinical questions, because all the exam and all the questions are based on a clinical exam. That if you do know very well what every disease is and all their signs symptoms, you kind of get the understanding of it, and you can clinically reason everything out of it. But you do really need to know basics.
That's true. That's true. And as you told me, Anna, you are a working professional and you've thoroughly worked, and, along with your prep. So how did you manage the time during the preparation or your job? Like, how did you go about with the time management?
I work afternoons because you have more work in the afternoons here in Spain. So I used to wake up very, very early at around 6:30 in the morning. Have my coffee and get right to studying up until more or less lunchtime. I try to have time to work out also during all my preparation, because I think it's an important part of managing my concentration and my energy levels. So I used to take one of my breaks, my long breaks during the morning was working out. And then after that, just went to work. And right before I went to sleep, if I didn't get anything or something was hard for me to learn, I try to revise it and then go to sleep.
Great, great. So very nicely managed and very well answered. Last question, any final words you would like to say about Academically and our team?
Academically, well, obviously, thank you very much. You helped me a lot throughout the journey, and I felt very confident going through my exam and very supported. So thank you very much.
Thank you. Thank you so much for sharing this eminent knowledge with us, Anna. It's a big day for you, and I'm sure you are in the mood to celebrate. So we, on behalf of the Academically team, congratulate you on your magnificent achievement and wish you all the very best for your future. With this, we'll end this interview, hoping it will help several global physiotherapists in their dream of clearing the APC exam and become registered professionals in Australia. Thank you so much, Anna. Thank you very much for joining.
Thank you.
Thank you. Goodbye.